Okay. Happy Thursday, everyone. My name is Crystal Torres. I'm going to go ahead and get started. I'm CCALAC's project specialist, and I'm super excited to talk about the Allied Health Internship Program. This is the informational session. Um, I know some folks are logging in. Just wanted to give a quick housekeeping rule. So if you have any questions, feel free to use the chat box to type in your questions. We will have an opportunity at the end for some Q&A. But if you have any questions, like while I'm facilitating the slides, feel free to raise your hand and ask your question away. Again, this is an informational session, so I want to provide as much of information for you all about the program. I'm super excited to talk about it, and it's super excited that you guys are all here this Thursday during the lunchtime hour. Yeah, and then I also wanted to tell folks if you can be just mindful of of unmuting yourself. So if you're accidentally unmute, please mute yourself. And yeah, and all of the information that I am saying today and right now, I will be sending it out in a follow-up email to you all. So that's the recording plus the slides. With that said, feel free to say hi in the chat box. And yeah, let's go ahead and get started. I'm just punching some folks inside as they're logging in. Okay, so this year it's the 2026 Allied Health Internship Program application cycle. And this is today's agenda. So today, I already did a quick intro. I'm Crystal. I'm the person who leads the program and also will be interviewing folks for the program. So I'm just excited that you guys are all here to learn more about the program. I'm going to provide a quick overview of CCALAC. As well as a program overview and timeline, and the application process and requirements, program expectations, and at the end, hopefully, answer some questions you may have. Alrighty, so a little quick overview of CCALAC on who we are, and then hello everyone. I love that everyone's saying hi on the chat. Okay, so CCALAC, we are Community Clinic Association of Los Angeles County. We were founded in 1994 and became a nonprofit in 1996. So what we do, we are an association that advocates for community health centers, and we have 65 member community health centers that are part of our membership. And a lot of these member health centers are all over LA County. They provide primary health care, including medical, dental, and mental health services to under-resourced population and communities in LA County. So they have over 300 clinical delivery sites, and they serve over 1.7 million patients annually. So yeah, our health center, our members are everywhere, and it's super exciting to be part of this organization and be able to provide these opportunities for folks who are interested in community health. So, this is a video. Hopefully, you guys can hear it. Let me know if you can. I'm going to play it, but it basically is going to give you a quick overview of our health centers. Can you hear it? Okay, so no. Okay, cool. Let me unshare and share again. Okay, this is a Norman Zoom. Okay. Okay. Sorry about that. Let me redo it again. What about now?
It's one thing to be part of your community, it's another thing to be part of it and being and serving it, giving back.
I always knew I wanted to work in a clinic setting. I did a comparison and I felt like my services were just better provided here at a clinic setting versus a private office.
Being a part of this community health center really helps us to serve Angelenos and their healthcare needs.
One of the reasons that I continue to work here is because everyone who shows up to work here believes in the mission, and it's palpable.
It's wonderful to work with a great group of other providers and be able to share stories and ask questions and learn from each other.
Being able to help people that are in positions where they need help is pretty rewarding.
My favorite aspect about my role is helping patients get better, how they improve, and hopefully try to cheer them up.
I love how passionate everyone is here, really passionate about giving quality health care to everyone.
Umma represents community in Arabic, but the root word of Umma is which is mother. And that represents, like, what do you feel when you see mother? You say, oh, it's nurturing, it's loving. And knowing that that is a part of what Umma is about is something that, I'm about.
Being here, we're able to provide the access to care that all our patients need. Not only our adult population, our pediatric population, and our elderly population. And I feel that patients have the comfort knowing that, okay, I have a center I can go to.
You know that the people actually really care about their patients and their community. And a lot of the people who work here are from this community.
This is my first job in the medical field. I had other jobs before, but working here has improved my work ethic and skills.
I work here at Queen's Care because I have a passion for helping patients.
We are a non-profit organization. Our main goal is for helping others.
My calling is what wakes me up every morning to be here and serve our community and our patients. And then I think seeing the strength of those around me.
And I want the children of this area who look like me to see that they can reach whatever dream that they have. And I think if they can come into a clinic and see someone who looks like them, who is in these positions, it motivates them.
Alrighty, and that was our old logo. Hopefully you guys were able to see it. My internet's a little bit funky today, so I apologize for that in advance. Oh, that's your personal clinic. Oh, awesome. So I'm glad folks are kind of familiar with the health centers. And then this graphic basically is, well, the video, I hope it provided you more insight of who the health centers are and who they serve. And this graphic kind of showcases where a lot of the health centers where their clinics are located. As you can see, a lot of them in the LA area, the city of LA, but it's all over LA County. So it goes all the way up to Palmdale and even Apple Valley. Alrighty, so our services here at Community Clinic Association, of Los Angeles County. We provide a lot of services such as resources. We were providing a lot of resources during COVID and even in the LA fires that happened last year to our health centers because a few of our health centers were actually really impacted by it and their communities. So we did provide a lot of resources, even hands-on resources out there. And then peer learning support. We have roundtables and peer networks, and then workforce pipeline programs, which I'm going to talk about. We have a lot, but the one that I'm going to talk about today is the Allied Health Internship Program. And then we provide much more opportunities, which I'm not going to go in depth. Alrighty, so while you guys are here, I'm going to talk about the Allied Health Internship Program. So I know you are pretty excited to learn more about this program and what we offer. So this program is sponsored by Cedars-Sinai as well as the California AHEC Center. And this is last year's cohort. We had 27 interns participate in our program. And out of the 27, folks were community health workers, phlebotomists, medical assistants, billing and coding folks, patient navigators, and folks in the undergraduate track. And many folks who are in the undergraduate track are either pre-med or pre-health, so like pre-PA, pre-nursing. And yeah, out of the 27, we also had 12 participating health centers that hosted those 27 interns last year. And out of the 27, 6 received job offers. And we're trying to increase those numbers this year. So these were the participating health centers that participated last year. Each year, there's different health centers that participate. Some of them are the same, some of them are different. So just want to let folks know that these 12 are, we don't know if these 12 will participate in this year's cohort. If you're like, oh, I want to work in, I don't know, the JWCH Institute. It always varies each application cycle because the health centers as well, they have their own application cycle that we do. But these are the ones that participated last year. So our overarching goals for this program is really we want to discover the next generation of allied health professionals. And we provide this program because we really want to invest in their potential and growth and really expose them to into the community health world. I think a lot of folks don't realize how much growth and opportunity there is in the community health world. It's a smaller setting, more intimate, and it's very like hands-on learning. So I think this program really helps you kick off your career and helps you kind of gain more insight and exploration of what type of career path is in community health. And of course, we want to train folks and provide them with the fundamental trainings that will help allied health professionals to lead. So we do provide virtual workshops in this program because we know a lot of folks who apply to this program are also new to their roles. So we want to make sure they feel equipped before they dive into the health center. And also connection. I think that's really big in our program. We really want to build connection that promote mentorship and peer networking. I think it's super important in any field, but specifically in healthcare, to gain that networking connection. Many of our alumni in the past, even though they didn't get a job offer at that specific health center that they were placed at, they end up using this experience to gain a connection at another community health center. So I think that's super important. And again, hire. So we hope to potentially hire qualified candidates to meet the health center's workforce needs. So those are the program overarching goals. And this is basically an overview of the program. So this year, we're looking for 30 individuals to participate in a 110-hour internship, and this is a paid opportunity. Folks at the end of the program do get a stipend of 1,500, and then depending on the internship site needs, they might receive a job offer. And then we also celebrate folks in our program, in our graduation program ceremony, and it's a lovely ceremony that folks come to our downtown LA offices and basically share their stories and their experience within the program. And again, before they start their hours at the health center, they must participate in our orientation and 2 workshops. And this is all virtual, and the dates are already set, which I will talk more in depth. So these are the accepted areas of study. So we are looking for medical assistants, LVNs, community health workers, substance abuse counselors, patient care representatives, behavioral tech folks, pharmacy tech folks, HIT folks, billing and coding folks, dental assistants, dental hygienists, phlebotomists, promotores or promotoras, administrative folks, as well as undergraduate majors. And what that means for undergraduate majors is folks who are about to complete their bachelor degrees or are about to or have already completed their bachelor degree in the past. Yeah, so these were the group of folks that we are looking for. Each year is different because it depends on the applicant pool. So yeah. And then these are the applicant requirements. So again, you must complete and submit the application before the deadline. Must be at least 18 years and older because we want to make sure you are you're an adult and you are able to be hired at the end of the program. Also, we want folks to attend the mandatory orientation and workshops, ability to complete the 110-hour internship within the time frame that I will be talking about in the next slides. And then again, your availability. Most of these health centers are open Monday through Friday. Again, it varies. There's some health centers that are open on like Saturdays. So it just depends on where you are placed. But most of the availability is through Monday through Friday from 8 a.m. to 5 p.m. And those your hours are then created with both the health center and yourself, of course. You tell them your availability and they figure it out with you. And then again, you must live in LA County because our health centers are in LA County. We want to make sure folks are able to have what do you call it? A shorter commute to the health center. It's not guaranteed that your commute will be short, but the way we like to match folks is kind of proximity to where you are to the health center, if that makes sense. And then again, have reliable transportation. And again, must be at least in the last 4 to 6 months of your program. Either you're completing your program or you already completed your program, as well as be in the areas of study that I just briefly discussed in the last slide. And then bilingual is a plus, but not required. So these are some other, oh, I have a hand raised. Yeah, Shahana? I'm not sure if I butchered up your name, but
Yes. You can
oh,
also call me Amy. Hi, Crystal. I think I emailed you about this, and I just wanted to ask this just because I think there's other students here that might be in a similar situation. I think some of us might be going to a community college. So if we don't have a bachelor's, but we're getting like our associates, would we still be able to apply for this program, like be eligible?
yeah, you will be eligible. Most folks that have in the past who've had their associates, they're either in like the administrative track, or if they have their associates in like a specific field, like community health workers, they're in that track, like if it's specific.
Oh, okay.
So
Oh,
you're still
okay.
eligible in that
Okay.
sense. Yeah.
So it would have to be like, would it have to be one of those? Or like for me, at least, I'm a psychology like associates for transfer. So would I still be eligible?
You'll still be eligible, but the undergraduate track is mostly geared for folks who have their bachelor, if that makes
Okay.
sense. Yeah.
Okay. Okay.
Yeah, but it'll all depend on the health center because which I'll briefly talk about, but the health centers are also applying at the same time as you guys, as you all are applying. But basically, we try to find, they let us know the type of interns they need at the health center, so it kind of depends on that as well.
Oh, okay, I see.
Hmm. Hmm.
And this is over the summer or over like the spring? The
It's
actual
so
hours.
the hours start or as earliest, which I'll talk more in the next slides,
Okay.
but your clinical hours, I guess, will start as earliest as June 1st. But the program starts in May in the sense that you will be attending the virtual workshops.
Okay, thank you.
Yeah. Great questions. Thank you. So the applicant requirements from the health centers. Just we like to tell folks the onboarding process. So you'll be onboarded with us, but you still have a separate onboarding with the health centers if you are accepted into the program, and you'll be onboarded kind of as a volunteer at the health center. So I don't know if you guys have ever volunteered at in a clinical setting, but they usually ask you for proof of vaccinations or COVID-19 vaccinations, and then due to the nature of the roles, again like TB tests. So just be mindful of that, and also must pass through a background check, and there might be other health center requirements required at your placement site. So it just varies on where you're placed, and that's just something to keep in mind. I think there's a question. Okay, cool.
Hello, ma'am.
Um,
I do have a question.
yeah,
My question is, is it possible during the like clinicals to like make a choice of the days that you can be available? Like I presently work for 4 days. If I can use like the 3 days that I'm available a week.
yeah. So if you get accepted into the program, your schedule is created with the health center. Usually the health center is open from Monday through Friday from 8 a.m. to 5 p.m. So you would have to pick your schedule, like you create your schedule. Like if you're only available Monday and Wednesday from 8 a.m. to like 2 p.m., that's what you let the health center know so they can figure out if they are able to precept you or your supervisors there during that time. So that's discussed with the health center. I will further discuss it more. I know these are great questions, but I'll further discuss it more in other slides. But did that answer your question?
Yes, ma'am. Thank you
Okay,
so
thank you.
much.
Yeah, thank you. Um, So the benefits for this program is again, you receive a 1,500 stipend for completion of the program, an opportunity to learn about community health centers, an opportunity to be hired full-time at the end, depending on the placement site, and again, an opportunity to be part of our workforce program alumni network, where you'll always receive like additional resources and opportunities. We've had folks in the past who have used me as a reference for like other jobs or even grad school. So I highly think that's a great benefit to have if you're thinking about applying to other jobs as well as like grad school after the program, and then a certificate awarded at the end of the program ceremony where you're celebrated. So those are the benefits. The next item is I will talk about the program application. But before I talk about that, is there any like lingering questions?
I have a question.
Yeah, go ahead, Carmen.
Um, so my main goal is to apply to PA school. And
Mhm.
does the externship, does that count as clinical hours?
So it depends on what exactly you're doing. So the Allied Health Internship Program has clinical roles and non-clinical roles. So the folks who do mostly like the clinical roles are like the phlebotomists, the medical assistants, and so forth. So I think it depends on what you describe it in your PA application, but we've had pre-PA students in the past participate in the program and they use it for their clinical hours. But just so you know, the PA student had a phlebotomy certification.
Okay, yeah,
Yeah, or a medical certification.
mine is a medical assistant.
Assistant. Yeah, medical
So,
assistant certification. Yeah. So that works.
okay, thank you.
Yeah. And I see a hand up from Tiff. Tiff, did you say a question? I don't know if I don't think I heard you. Oh, I think there's something in the chat. Yeah, Tiff, if you can please type your question. I didn't hear you unless you don't have a question anymore. Okay, any other questions before I dive in? Oh, okay, I think a question came in. Okay, okay, cool. We'll wait for your question. And when it comes in, I'll answer it. But I'll go ahead and start talking about the program application. So the program application consists of the program eligibility questions. So before you even start the application, it's going to ask you questions if you're eligible for the program. They're yes or no questions. And if you pa like say yes to everything, you're eligible to the program. And then the next part is contact information and demographic questions section. And then the next part is the area of study where you input what area of study you qualify for in the program. You can check more than one because I do know folks are in one and more. I have one like they apply to more than one area of study. And then your personal insight questions. So I really advise folks to take the personal insight question seriously in the sense that please write like a meaningful paragraph. It doesn't have to be it doesn't have to be like a 10-page paper or anything. Either a meaningful paragraph or an essay talking about your interest in community health, as well as telling us about your experience working in diverse populations in a community setting. This just allows me to learn more about you and yeah, so those are the personal insight questions. And then after that, you just then submit your most up-to-date resume and an unofficial transcript document. I know I've had questions where sometimes they don't have the unofficial transcript document, but if you have like your certification uh like your certification of the area of study, that also is okay to upload. And then once you upload that, and those are uploaded in PDF format, once you upload that, you can then submit your application. And the deadline this year is March 20, 2026 at 11:59. Any questions about the application? Oh, there's questions coming in. Okay. So how long is the information? Wondering if it's better to wait and ask the question. Informational session, we hope to end at 1, and we hope to have Q&A at the end. Oh, and thank you, Amy, for answering. Okay. I had two hands raised. Okay, Rose and then Brenda.
Yes, thank you. Just about the deadline, is it kind of like a rolling situation where you kind of review as they come in, or would you review at March 20 or from March 20?
No, I review as they come in. So as we're speaking, a lot of interviews are being scheduled for next week already. So I always advise folks to apply sooner if
Okay.
able to. Yeah,
Okay,
great
thank you.
question. Yeah. And Brenda, go ahead.
Yes, hi. I have a quick question. In terms of transcript, does it have to be like all transcript, which is credit? Because I also have non-credit classes, which I just finished my medical assistant program last year. So does it have to include all classes, or as you say, can we send the certificate of
You
medical assistant program?
you could send the certificate if that's easier. It's just I need proof that you are enrolled or you completed the program or
Oh,
are
okay,
about
I
to complete
see.
the program. Yeah.
Okay, so all right, that was just my question because I just finished my medical assistant program last
hmm
year, so that will actually work out, right?
Yeah, it would.
Okay, all
All right,
right,
thank you.
perfect.
Great
Thank you.
question.
Yeah.
Okay, and I think there is another question. Where do we send the resume? It's on the application. And thank you, Diego, for answering. I like that folks are answering each other. So we can submit PDF. Yeah, if you have a PDF of that, you can submit it. Either it's like just proof of enrollment or that you were enrolled, basically. Usually an official transcript could be easier to get, but I know everyone's situation is different. But if you have some type of certification, you can put that instead if you couldn't access your unofficial transcript. Hope that answers your question, Vanessa. And then for Tiff, I'm currently getting. Or I'm reading. Tiff, I asked the question. Okay. Tiff, we would want you to be a certified CHW. However, I know since you're finishing your MPH, our health centers would want to take you in if you were an applicant. And they'll probably put you like in the undergraduate track doing something related to that field of study. I hope that answers your question. But if you're interested in like CHW work, that's something that we can discuss if you are interviewed. And Brenda, do you still have a question?
No, I'm sorry. I didn't
Oh, okay.
lower my.
Okay, cool. Okay, cool. I hope I answered everyone's question. I'm gonna move on. Oh, Rose, yes?
Sorry.
All
Um,
good.
so for the transcript uploading, so if we have our medical assistant certification, did you want us to also upload our transcripts and the medical assistant certifications, or just the medical certification is okay?
It's either or. So whatever, if you want to just put your certification, that's fine.
Mhm. Oh, okay,
Or
okay.
yeah, it's either or.
Either or. Okay,
Yeah.
okay, sounds good. Thank you.
Alrighty. Thank you. Great question. Alrighty. I'm gonna move on to the next slide. So, what do you have? This is the link to the program application. As I mentioned earlier, the recording will be on the website. And I'll also send a follow-up email with the recording as well as with the slides. And yeah, so, program timeline. So, this is the program timeline. As we know, the application is currently open. The deadline is March 20 of 2026. And then interviews happen on a rolling basis. So, it happens between January to mid-April. Um, And then the week of April 13th, acceptance letters are sent. So it takes a while because I do want to interview everyone or like everyone who um, applies until the deadline. So even if you apply on March 20th, I'll still see your application if you apply. But I just want to note that interviews are on a rolling basis. And then acceptance letters are sent the week of April 13th, 2026. And the mandatory program orientation is May 14th from 6 to 8 p.m. These are all virtual through Zoom. And then workshop number 1 is May 21st, 6 to 8. And then workshop number 2 is May 28th from 6 to 8 via Zoom. And these workshops are mandatory unless there's like, I know some folks are graduating during that time. Unless there's like some type of circumstances, then folks who are accepted into the program, one, it has to be communicated. Two, folks then get like homework. Um, but yeah, these workshops are already set in stone. And then internship hours begin as earliest as of the week of June 1st of 2026. And then you have that time frame until July 31st to finish your internship hours. And program graduation is August 6th. And as mentioned on the bottom of this slide, this timeline is subject to change. If anything arises, applicants will like be notified. Other than that, any questions about the program timeline? I know that was a lot. Oh, these interviews are conducted via Zoom. And then I am F1 student would be what does F1 students will still are you saying first year students in the my pre oh international students. If you're eligible to work in the US, you are eligible for the program. Hope that answers your question. Any other questions, comments, concerns? Okay, I'm moving on. Program requirements and expectations. Again, we want folks to attend and engage in all virtual didactic workshops. I know folks sometimes virtually could be what do you call it? Not as engaging, but I try to make my the best effort to be engaged. Like I like cameras on and stuff, and you'll see that if you are accepted into the program in the virtual workshops. We want folks to be curious, respectful, and present. Folks to listen actively, promote respect, encourage open dialogue, and embrace vulnerability because we want folks to connect with one another because the time you guys are all together is usually during the virtual workshops and then the program ceremony, since everyone's placed at a different health center. Um, and then we really want to invest in your professional development that will benefit your career pathway, connect with your cohort and network, and again, complete the 110 hours in-person internship experience. Oh, and this is an important key no a thing to think about. So it's 15 hours per week minimum. So our program is pretty flexible because we only require at least 15 hours per week minimum to do your hours. So that gives you like 10 weeks to complete your hours or 25 hours per week maximum if you have the availability. So that gives you like a month to complete your hours. And yeah, we want folks to optimize their experience at the community health center and really engage with your supervisor, find mentors, and connect with peers. Take initiative and utilize all resources and opportunities. We do provide other optional workshops during the internship for folks, if such as like resume building and interview support. And also another thing is we really want folks to communicate and complete all required forms or even communicate if you during the interview if you have any issues or anything. Communicate. I cannot stress that enough. And then must be responsive to all emails in a timely manner. And then complete evaluation and alumni surveys during and after graduating from the program. So those are some program requirements and expectations that we have for our interns. Any questions? And then the next thing is the program requirements and expectations continued. So again, if we're accepted into the program, you will get an email, but it will ask you if to respond to that acceptance letter in a timely manner because there are folks who are then waitlisted. So for example, you apply to the program, get accepted, but you realize you don't want to do the program. Um, please let me know or if you don't reply, someone because folks are also waitlisted, they'll take your spot. So be on the lookout for those emails. Also, program participants will receive an orientation packet that will include, but not limited to, like completing like a sign up media release form, sign program agreement form, as well as a W-9 form. And more information and guidance will be given in the orientation on May 14th, but those are things to keep in mind. If you get accepted into the program. And with that said, I hope everyone applies now who's here. I feel like I saw a few folks who have already applied. So hopefully you what do you call it, answer the Calendly link to get interviewed. So other than that, any questions, comments, concerns, and then I will also close this. So if folks wanna ask me any questions. And then this is my contact information. Naomi? Hopefully I said it right.
It's Noemi, but I was wondering so about how many people are applying and about how many, well, you said 30, right? So I just
Hmm.
want to see like the amount of people that are applying just to get an idea of like the level of.
Yeah, great question. This year we have received over 100 applications and we are looking for 30 folks. Hopefully that gives you insight.
Mm-hmm. Okay, thank you.
Hmm. And then I don't want to butcher this name. Isle Easler?
It's
I'm
okay. No worries. Everybody
sorry.
butchers that name all the time.
Sorry. How do
No,
you
it's
pronounce
okay.
it?
So it's pronounced Ilse, but thanks
Oh.
to Frozen, everybody just calls me Elsa when that name pops up. I don't know why.
Oh, okay. For some reason, I thought the other letter was like silent for some reason, but oh, okay.
It's okay.
Hi there.
Hi, my question was, when you said to respond back in a timely manner, like let's say for instance, if we get the email notification last night, but we check our email in the morning, just wanted to know how much of a time lapse do we have until it gets passed on to the next person in the wait list.
Oh, okay. So that's if you get accepted. I give folks like a week to respond. Um, the email. So like they have a week to respond if they want to participate in the program or not.
Okay. Okay.
And then yeah, so hopefully that's enough time. But I know things happen. Again, communicate. But I assume if you don't respond after a week, like you're not no longer interested.
Okay. No, that's good.
Yeah.
Thank you.
Hmm. Yeah. Great question. Amy?
Yes, I was just a follow-up to my question earlier about the associates. So you were saying that um like the undergrad track, which would be kind of like the only one I'm eligible for, that one is more for uh certain like people with a bachelor's rather than associates, or did I get that
Yeah,
wrong?
so we have a good mixture. Mostly folks in the undergrad track are folks with a bachelor degree. But we've had AA folks in the past, like if they are interested in like building and coding or other stuff, participate in the program.
Oh,
So I
okay.
think that's just like during the interview process, you kind of let me know what you're interested in, and then I will then again, it'll depend what the health center needs as well. So yeah, it's just communicating that because sometimes I know it could be like a um what do you call it? It could be a little bit confusing. But yeah, you'll still be eligible for the program, if
Oh,
that makes
okay.
sense.
I
Yeah.
see. Like even though I'm like because I the ones you mentioned were like administrative, but I'm a psych major, so that
Mhm.
wouldn't automatically disqualify me at all.
Yeah, that wouldn't disqualify you at all, but it would be like most likely it would be like an administrative role or if there is a certain project, like it would be non-clinical. If that,
Oh,
yeah.
okay, okay, I see. And what was it called? And for the interview, is it like everyone gets an interview as long as they complete the application and everything, or is it like you have to have a good application and then from those people they get interviewed?
Yeah, I'm reading the applications and folks are invited
Oh,
for the
okay.
interview. Yeah.
Okay, okay, thank you.
Hmm. Great question. Um, no, Amy? Did I say it right?
Yeah, thank you. So when I was filling out just to come to the Zoom, I was asked like what my interest was, and I didn't really see mine, so I just kind of picked a random one. So I'm curious about the application, if what that's gonna look like. For example, I already have a bachelor's, but it's a bachelor's in nothing to do with the medical industry. But I'm back in school doing pre-allied health at the City College, which is basically just like prerequisites for getting into accelerated bachelor's program. And the reason why I'm interested in this internship is to get the clinical hours and experience for my application to be, just stronger. My question is, will when I'm applying, where does that fit? Like, how do I communicate that? And does and if I already have a bachelor's, do I choose the bachelor undergrad program, or do I, you know what I mean? It's kind of like I'm a bit confused, and I don't even know if I articulated myself good in that
Mm,
question.
yeah, you did. So what you would do is if so it sounds, are you pre-nursing or like pre-med, pre-health?
Well, it's my AA will be in pre-allied health because that's
Mm-hmm.
the certificate that I would qualify for. But it's really just I'm just taking the prereqs that I need to be able to even apply to a university for the accelerated bachelor's program for
So what is your accelerated bachelor's program?
to become our RN.
Okay, so it's nursing. Okay. So what you would do is you would click, if you already have your bachelor degree, you would click the undergraduate track of the application, and then you will explain that in your personal insight questions.
Okay.
Yeah. Yeah. Unless you have like already a medical assistant certificate, you can check that as well. But if you don't, I just recommend putting that undergraduate track and then in your personal insight questions, explain your interest into the program and how you're kind of a career changer. Because we have past applicants who have done that where they're like career changers. Um, and that's totally fine.
Well, I have a CNA. I have a CNA certification as well. I just never used it. I just got it again just to for my application
Mm-hmm.
because I'm still in school, so I
Yeah.
can't work.
Yeah, I recommend doing the undergrad track because unfortunately we're not looking for CNAs for this program.
Yeah. So do you
Mhm.
think that I'm a good candidate for this program, or do you think that I should just go and like use my CNA to just like work at a hospital or something like that?
I would encourage you to apply,
Okay.
um, but it's honestly up to you if you're interested. Um, you just have to like explain yourself in the personal insight questions, if that makes sense.
Okay.
Yeah.
Yeah, thank you.
Alrighty. Thank you. Great question. Brenda?
Yes, hi, I'm sorry. My question was, during the process of the application and interview and acceptance, and as I said, I specified that I just finished my medical assistant program, which I'm waiting for my certificate. Is it when you get accepted in order to volunteer in the clinical setting, do you have to be licensed? Since I'm actually on the way of it.
For like medical assistant?
Yes.
Yeah, so you have to be certified. So you have to be a certified medical assistant to participate in the program.
So, like, okay, so I mean, when you mean certified to have the certification that you finished the program, not just the license, like, from the oh,
You have to have your license. You can have your completion of the program that still works, but if you have your license, like that will make you a stronger candidate.
Well, okay, I see. Yeah,
Yeah.
because I'm actually on the way of it.
Yeah,
Okay.
so that you still qualify because it's folks who are about to either complete their program or have completed the program.
Okay, I see. All
Mhm.
right, perfect. Thank you for clarifying.
Yeah, thank you,
All
Brenda,
right.
for that question. Anyone else? I know that.
Hello, ma'am. Yes, ma'am. I do have a question. For the like, I just finished my medical assistant in December in LA City College, and I've also passed the AMCA
Mhm.
certification exam, but I still don't have the certificates mailed to me yet. I do not have it yet. I don't know for how long it's going to take before I receive it. So I'm like, I started the application, but I could not um, upload certificates and resume. I had to save it and decided to wait and see if I get the certificate for the medical assistant. Although I do have, because I'm a registered nurse midwife, but not here in US. I did that back home in Nigeria before I moved there. So if I and I did I I don't think that like IHSS and medical terminology would help if I submit those ones. So I not uploading those ones. But I don't know if it's okay if I can submit without receiving the
Um,
certificate yet.
can you at least submit like proof that you were enrolled in it in those classes?
Yes, ma'am. I can prove that. Perhaps if I tell
Because that
if
would
I
be
go to the school to get
yeah,
okay.
that would be sufficient as long as you have your up-to-date resume or a proof that you completed those classes as like an unofficial transcript. If you can access that, you can upload that.
Okay, ma'am.
Yeah.
Thank you so
Thank
much,
you,
ma'am.
Helen, and congrats on getting your certification.
Thank you so much. I appreciate you.
Thank you. And Joanne, you have a question? And also, folks, if you have questions on feel free to type them on the chat as well if you don't want to say it out loud. But Joanne?
Hi, Miss Torres. Hi, this is
Hi.
Joanne. Hi, I'm the one who is a F1 student, international student.
Mm-hmm.
So currently I'm in my pre-nursing and still
Mm-hmm.
in class. And then I graduated an associate AA. And then
Mm-hmm.
I eligible to be part of this internship.
Yeah, well,
I don't have any medical certificate, something.
you yeah, if you don't have any like certificate, if that's what you want to like do the medical assistant path, you would not be eligible because we want folks who are about to finish their program so they're like job ready to be hired. Um,
Yes.
yeah. So unless like you want to do another track with your AA, but like for like the medical assistant, you wouldn't be eligible.
But I'm into pre-nursing, so it means related to the medical something.
Yeah,
So,
but a medical assistant is like an actual like program,
um,
certification program that they undergo. Um, so you wouldn't be eligible. Like you
I,
wouldn't be doing like clinical work if that's what you're looking for.
I see. Okay.
Mm-hmm.
Thank
Thank
you.
you. Great question. Okay. There's questions in the chat. I'm gonna just read them out loud. So that one's from Amy. If we get accepted, are we able to also apply next year and get a chance to do the internships again? Yeah. So if you want to do the program twice, that is you are able to do that. And then are most applicants interested in the same or few fields? If which fields are these? So it depends, Rachel, great question. It honestly depends on the applicant pool. For instance, previous years we always get like medical assistants are pretty popular. Uh, Also, undergraduate track is pretty popular. So it honestly depends, and it also depends on like the health centers on what they're looking for. Um, so I highly recommend just applying. Because sometimes we get like a bunch of medical assistants for that year, and sometimes it's like less in that year. And I'm just using medical assistants as an example. Hopefully that gives you insight. And then Noemi, I see that you have your hand up.
I have two questions. One, it's like let's say do we only get to choose one thing like medical assistant, or can we do like a couple of things that we're interested in? And then my second question is, you mentioned that it's that it's on a rolling basis. So are you guys gonna reach your 30 at some point and then just close the application? Is that, or do you guys accept all applications until March 20 and then pick from the pool?
Okay, so to answer, there was like multiple questions. I'm trying to think. Okay, so to answer the last question, so it's on the rolling basis, so you'll get interviewed earlier, but application doesn't close until March 20th, meaning folks, I will still be screening folks until the March 20th deadline. And then from there, after the March 20th, that's when I will consolidate and then get my 30 interns. And then in the week of April, folks will then get a letter um, saying if they're accepted or not or waitlisted, and then it goes from there. So it honestly depends on how many folks then accept the offer letter. For those who are waitlisted, I saw a question about waitlisting. So it honestly depends. Usually, what happens is we do have folks who get accepted into the program, go to the orientation, and then turns out I don't know, they don't want to follow through with the program. So that's when we then have openings for those waitlisted people. And then when you're waitlisted, you also get a letter saying like you're waitlisted. If what do you call it? If an opening comes up, would you accept it? And then either you tell me yes or no. Just so I can keep that in mind in case we do have folks who drop out from the program.
Yeah.
Um, so, and I think you had another question, but I
Yeah,
forgot it.
basically when I up for the application, my interest, let's say it's more than just one, like this is my top interest, but if that's not what you guys are looking for, or that's not what's available, can I choose other things as well, or can you only choose one of the?
So in the application, there has been folks where they choose like they have their medical assistant license, they also have their phlebotomist license, but they also have their undergrad track, for example. And I see that, and then I see the reason why they want to do the program. In the interview, that's where it's further discussed. Like, what is your priority? I notice you have these three. What is your like top one? Do you want to do phlebotomy in the program, or do you want to do more medical assistant, or do you want to do something in the undergraduate track? So that is discussed mostly in the interview process, and then I will kind of tell you like um, I would gain guidance on what you want, and then after that, I would also keep that in mind with what the health center wants. Like for example, this is just a scenario. It's not um, it's not what's happening. But for example, if there's a lot of like like if I'm interviewing a lot of phlebotomists who are interested in the program, um, and you have both phlebotomy license and medical assistance, but it's probably more competitive to be in the phlebotomist track because there are more phlebotomist applicants. You might want to be like, I like phlebotomy, but if there's like an opening for medical assistant, I'm still open to that
Mm-hmm.
like that. So you just have to be more upfront and communicate that to me. And that happens mostly in the interview process. But that
Awesome.
was an example. Yeah.
Okay, thank you.
Okay. I know we're almost out of time and I have a lot of questions here. Okay. Let me try to answer them. Able to get things. Okay. Are most applicants interested in the same or few fields? I think I answered that. Do you already have a list of what positions are being sought by the clinics? Not right now. Clinics, the health centers are actually applying to the program. Their what do you call it? Their due date is in February 20th. So by like mid-February, that's when I would know what they're looking for. So right now I don't have an active list, but we are looking for people who are in the areas of studies that you see on the website. Hopefully that answers the question. And then if we get accepted for the internship hours, our medical centers open on weekends or do our hours. So the health centers are open mostly from Monday through Friday, 8 a.m. to 5 p.m. It depends on your site if they're open on the weekends. So that's something you discuss with them. And you also create your, what do you call it? Your schedule with them. Um, and then for my MPH status, yes, Tiff, you can check off those. And then any other questions, comments? I think I answered. Alrighty. Right on time. It's 1 p.m. Okay, so hopefully you all are able to apply to the program this year. And yeah, if you have any questions or comments or questions that come up later, feel free to contact me via email. This is my email, and I will be sending you all a follow-up email with all this information and the slide deck. So other than that, hope everyone has a lovely rest of your day. Thank you for joining. And I'm gonna stop share and then stop recording.